Hello, good morning. It's 1 a.m. in the morning, and as you can tell, I'm featuring my nice bed hair this morning. And I was inspired by one of my patients yesterday. And as usual, my patients and parents are usually the source of my inspiration. They motivate me to be a better pediatrician. And not only that, they motivate me to be a better person too. I certainly am inspired by this particular parent who basically gave up her lucrative and successful career to take care of her uh, children with special needs. And we were talking about ADHD, and the person who has ADHD usually has a unique relationship with his or her siblings. And I kind of break into this into two different categories. Usually, the relationship falls between the child with ADHD interacting with older siblings and ADHD um, interacting with siblings who are younger on this end. So with older siblings, a lot of times I notice that they tend to fall under, they automatically assume a role. That's kind of like the role model or the identity of the good child, because uh, unfortunately, the child who suffers from ADHD often gets in trouble, needs a lot of reminders, and either due to their underlying ADHD or as a side effect of the medication, they tend to have mood swings and they tend to be more emotional. So, as the older, more responsible siblings, sometimes they adopt this role as almost like a pseudo parent. And obviously, you have to be careful with this because a lot of times they're just simply too young. They're emotionally and um, mentally, they're not really to become a parent, and it's not always necessarily fair to them. And as an older child who may have a greater understanding of the situation, it's certainly a good idea to involve them in the process of diagnosis and treatment. Explain to them what the doctor is conveying to the parents. A lot of times they are not at the doctor's office appointment, and sometimes they are. And I've had situations where the older sibling actually serves as the unofficial interpreter for me because the parents, they may not have fluent mastery of the English language. So when it comes to older sibling, basically just remind yourself that to continue treating them as your child, not as um, a surrogate parent for uh, to be responsible for your child with ADHD. But oftentimes it can come as a great asset, especially if they're significantly older than a child with ADHD. Um, I have many situations where the older sibling is the only one who can help the younger sibling with ADHD uh, doing their homework because sometimes it's difficult for parents to be the main person who is responsible for guiding uh, the child with ADHD through the homework process because either busy with work or the child may not want to listen to the parents because it's not the teacher. But surprisingly, the older sibling can play a very important role in this process, either tutoring or just coaxing or motivating the younger sibling to do the homework. When it comes to the younger sibling, a lot of times I notice that they tend to end up being the target of their older sibling with ADHD, of their wrath, because either during their emotional outbursts or uh, for their impulsive behavior. I had situation where the child with ADHD will walk over and just like smack their younger sibling on the face or throw things at them, uh, sometimes actually leading to bodily injuries. Um, and it's also easy to focus your attention on the child with ADHD. And I know it obviously wasn't your intention, but when you're constantly finding yourself having to nag and remind the child with ADHD, sometimes you end up spending less time with a younger child who doesn't have ADHD because he or she is the good kid and you don't really have to worry about him or her. But that's, of course, not fair either because they deserve the same amount of attention and parenting as the child with ADHD, even though they may be more independent when it comes to doing homework and doing house chores. So just don't forget to spend quality time with them, alone time with them. Maybe you can pick a special time of the day. Um, maybe after dinner, before bedtime, read a story with them. Uh, Go to their room and just sit down with them, saying, "How was your day? Do you want to talk about anything? Is there anything that's bothering you?" Of course, you do that with the child with ADHD too, but just basically don't forget your other kids. And as parents, it's a tough job. You're torn between the needs of all your children, and as any experienced parents understand, your children, they need different things from you. And of course, you become the parent. You're striving to become the parent that they're asking for. So I hope this is helpful, and these tips are useful when it comes to um, being the best parent that you can be. Of course, I'm inspired by all my patients and parents, and this is Thanksgiving Day morning actually. So I hope you have a amazing Thanksgiving, and this is pretty much the first normal Thanksgiving out of the pandemic. So stay safe, and if you can, get vaccinated and get your booster. All right, take care. Bye bye.